I chose to become a neurologist because I have a very personal attachment to the field. I have a number of family members with diseases that we treat, seizures, strokes, Lou Gehrig's disease, and my mother has multiple sclerosis, and that is the area I chose to specialize in based on the experience I had growing up with her struggling with that awful illness. I think one reason why you might consider coming to the Sansom Clinic and possibly to see me if you are struggling with one of these illnesses is that I did extra training in multiple sclerosis at the University of California, San Francisco, which is a very wonderful multiple sclerosis center here in California. That affords me an opportunity to have a little bit more insight into this illness. As you may know, as one who struggles with that condition, it's complicated and the medicines are becoming increasingly complicated, so being able to understand all that goes into taking care of someone with multiple sclerosis is important, and I think hopefully I can provide a little bit more than the average neurologist in that realm. The thing that I'm most excited about in my particular field is that we have an increasing ability to help people with multiple sclerosis. When I started medical school, we only had 3 medicines that we could use to treat this illness. We now are about to get our 15th FDA-approved medicine with a bunch more on the way. And in addition to that, we have a lot more opportunity to intervene with symptoms and potentially in the near future with the ability to repair the brain, which when I was a kid was science fiction. And that is very exciting because it means in a very real way we can improve the lives of those people that are struggling with multiple sclerosis. The electronic health record is extremely important because it allows us to have real-time access to the data that we need, things like laboratory studies and MRIs, and it allows us to be able to bring that all together in a way that is very helpful. One of the big problems we used to have is we couldn't read our own notes and definitely not the notes of our colleagues. That is no longer an issue with the electronic medical record. Also, a fantastic advantage is that it allows us access to our patients. Once we receive results, we can send them via email. You can access them via a HIPAA-secured server and be able to look at these results real time rather than having to wait for us to fax them or come back for a follow-up visit to see them. So I was drawn to Sansom Clinic and to Santa Barbara because I was born and raised in Santa Barbara, California, and I love the Central Coast, and this is home to me and to my family. My wife grew up in San Luis Obispo, and this is where we have always loved being and where we've always felt like is home. I feel like this is a place where people care about each other, and we're very much invested in the community, and Sansom Clinic, I feel, has that same mission and really wants to make every life in the Central Coast better.